About 30 years ago, I was diagnosed with skin cancer, and my only option at that time was Mohs. But when I was diagnosed with skin cancer this time, my doctor recommended this radiation treatment, which was far superior.
I do appreciate that I was given a choice. I didn't know there was a choice. I thought it was only the cutting. And when she explained what it was about, I thought, I'll give it a try.
After I got the recommendation for surgery, I thought, well, I'm sort of locked into this. And then in talking to a nurse at the hospital, she said, there's a whole nother thing you can do with this.
When I was sitting in the doctor's office, I noticed a sign that said, have your skin cancer removed, no pain, no stitches. It was just everything that I was looking for.
It was absolutely a sigh of relief when I found out about the procedure, and it was pretty much painless and doesn't leave any scars and marks on you, and I thought, boy, this is the way to go. This is technology just coming into the 21st century.
When I came to my doctor, and he sat down and we talked about my diagnosis, and he talked about this method, I'm thinking, oh gosh, where do I gotta go now? What do I gotta do? It was right there in his office.
She just puts the machine up to where the radiation's going to be taking place, and 30 seconds later, I'm having the thing taken off again and out the door.
The images shown to me, so that I could watch the progress, fascinated me and made it, let's go back and keep this up, because I could see improvement after each treatment.
It was actually very reassuring to see that it was shrinking, because if you have cancer, you want it to go away, whatever kind it is. And the fact that it started shrinking made me very comfortable that this procedure was going to work, and work in a way where I wasn't going to have any suffering or any pain with it. Because of this option and the results of everything that's happened, I would definitely recommend them to my friends, my family.
I know a lot of people who've had surgery for skin cancer. And to look at what they went through, and to look at what I went through, where there's absolutely no visible mark whatsoever, is a no-brainer. It's like apples and oranges.
I don't see anything. In fact, people have actually asked me, which I've talked to them about what I'm going through, and they said they've never heard of this before. And they said, well, where is it? And I said, that's the best thing about it. You can't see what I'm going through. And so I have to actually point it out, and they'll say, but there's nothing there.
My daughter got married after my 15th visit. I was in that wedding, and it was a huge wedding, and there was absolutely no sign whatsoever of what I was going through. I would highly recommend this treatment to anyone I know, friends, family, or even foes, because this is the way to go as far as I'm concerned with skin cancer.
The surgeon that reconstructed my eyelid after Mohs surgery was not aware of IG-SRT. I have since talked to him and told him about it. He was quite interested, and he said that he would look into it. I hope he did.
When I go to church, I talk to some of the ladies, and they say, well, let me see it. And so it was really very pleasant that I could show them and say, look at this, it's all over and there's no scarring at all. It's gone. The cancer is gone.